came across patients who said they do Zumba dancing. Some
I always have a side gate for you. I always.
he had severe chest pain, so he came. For different sets of patients, you might have different sets of tests, no? So what do you commonly do here, like commonly? So that after that the patient comes to me. So the entry point is from you people. So you are the first areas. So whatever the test which you do commonly, different groups of patients here. We routinely advise the basic checkup. Basic checkups includes routinely a basic blood sugar, preferably fasting, and we do a lipid profile, and we do some liver function test. And during our routine evaluation, if you found out that he is a little bit hypertensive, we have to evaluate his renal function test, mainly urea creatinine, probably uric test to find out any urine microalbumin. In case if he is having some little high BP, we also recommend an ECG basically. And if you don't find any problem in the ECG, okay, we like that. But if you find some changes, hypertensive changes, because long-standing hypertension, as we all know that there will be changes in the ECG. If any suspicion, we can go for higher referral, like cardio referral for any code.
So Dr. Kader, I think my question will be for you. So in this current post-COVID scenario, we see a lot of young deaths, especially after exertion, especially after like strenuous activity. So what is your take on this?
So many reasons. People who are previously not doing exercises, all of a sudden they have some motivation or something, so they jump into the gym and just start unusually strenuous activity.
Over-enthusiastic.
Over-enthusiastic. And the problem is they don't realize those two different sets of exercises. The one is endurance, one is resistance. They don't seem to realize the difference between them both. Yeah. The endurance is the routine walking or the stretch or the cardio type, more of the cardio exercises. The resistance ones is the heavy,
the weight training and the strength training.
You build up a past. So everybody is fascinated by that. Everyone wants to have the powerful biceps and biceps and quads. And in that process, they land up. Yeah, now I remember I had seen one, not here, but in India. This was a 24-year-old boy. And what he did, he was just a routine, I think college student or something. He did not have his dinner. The whole night he slept. Early morning he ran to the gym. I don't know what happened to his mind. So just like this, all of a sudden, without warm-up, he started that weightlifting. So after weightlifting, within some 10 or 15 minutes, he had severe chest pain. So he came. Because he was 24-year-old, we just didn't expect anything. But slowly the ECG showed changes and the pop became positive. Then finally it was MI only. So then we thrombolized him, and then we, at that time, we referred him for the angiography outside.
PCI.
We didn't have in our center at that time. They don't realize that. I tell all my patients, if you try to do that heavy weightlifting, the heart doesn't like that. So basically try to avoid all that. You do some minimal weightlifting. Walking, swimming, these are the best. And now I also came across patients who said they do Zumba dancing. Some like, wow. See, these things they can do, but ultimately it is not an ideal way of healthy lifestyle. Or the Zumba and the rope kind of exercise.
Yeah.
These will put more strain on the muscle.
The Pilates.
So they will come with costochondritis. So that will create a doubt whether this is cardiac or not. So the ultimate takeaway point, what I have learned for all these past years is that heavy weightlifting seems to create a problem for everybody. And not to mention the fact some will have this hypertrophy also, hypertrophic cardiomyopathy.
Josium.
We have seen so many young people, for some pre-employment or something, they will come. When we keep the probe, we will see the heart is dilated. They will have a dilated cardiomyopathy already. Without no symptom, very happy. Okay. So the moment we see, then only we will warn them. Okay, after this, you take medications properly. Don't risk. Don't lift any heavy weights. And that is one of the major causes of sudden death, cardiac arrest in